Welcome back, everybody, and welcome to everyone inside the conference call in this meeting. We are here for the second part of the 5th day of the Knowledge Festival, and the second part is about medicine working on immunity. So for starters, we have 3 papers, and after that, we will have a discussion round on this topic. So first paper presenter will be Dr. Shilpa, is that?
Yeah.
Yes, Dr. Shilpa will present her paper, and we're very happy to have her on. So please, doctor, go ahead.
Okay, sir. My voice is clear, sir?
Yes, everything. I mean, it's crackly a bit, but hopefully it will keep going throughout the presentation. No problem. Go ahead.
Okay, sir. A warm good afternoon all. Myself, Dr. Shilpa, second year PG scholar from the Department of Shalatandra, Amrita School of Ayurveda. Today, I am here to present before you on the topic advantages of an Ayurvedic formulation in ulcerative colitis. Move to introduction. Ulcerative colitis is one of the commonest forms of inflammatory bowel disease. Ulcerative colitis is a chronic idiopathic inflammatory disease that affects the colon, starts particularly from the rectum and sigmoid colon, extends proximally in a continuous fashion, unlike the skip lesions in Crohn's disease. So in simple terms, the inflammation is continuous in ulcerative colitis, whereas in Crohn's disease, there will be healthy portions in between the inflammatory lesions. It affects individuals in all age groups, particularly those between 3rd and 4th decades of life. Moving to etiology, the exact cause is unknown, but several theories have been put forth, of which the main ones are infective, nutritional, psychosomatic, and immunological. Etiological studies on IBD have centered on several factors, including host genetics and immune responses, the gut microbiota, and the importance of environmental stimuli in disease pathogenesis. Gut dysbiosis has been consistently shown to be associated with IBD. Due to expansion in the application of high throughput deep sequencing technology in the past decade, we are able to gradually unveiling the role of the microbiome in the development of IBD. These findings have improved our knowledge on the functional mechanism of the microbiome in the pathogenesis of IBD. During homeostasis, gut microbes induce an immune tolerance phenotype in the host, while in inflammatory conditions like IBD, antigens from dysbiotic microbes activate the T cells, Th1 and Th17 cells, resulting in tissue injury. Decreased mucus layer and microbial penetration and persistence in the intestinal tissues. This mucosal injury results in further uptake of microbial antigens, TLR ligands, and viable organisms that perpetuate the immune responses. Main symptoms are bloody diarrhea, rectal urgency, tenesmus, rectal discharge of mucus, sometimes blood and pus is common. Other symptoms include abdominal pain, fever, weight loss, joint pain, skin rash, and fatigue. Next slide. Diagnosis. Ulcerative colitis is diagnosed based on history, assessment of endoscopic and radiological appearances, histology, and microbiology. The X-ray here demonstrate loss of hostal folds, that is a normal fold of intestine in the entire descending colon. See the white arrow there, with a granular appearance to the mucosa, suggesting small ulcerations. Moving to the treatment. Next slide. There is no specific treatment as the etiology is unknown. Primary treatment of ulcerative colitis is medical. The components of therapy are antidiarrheal, antibiotics, corticosteroids, diet, vitamin, minerals, and general support. Means surgical treatment is total proctocolectomy. Ulcerative colitis in terms of Ayurveda. Depending on the presenting complaints, ulcerative colitis could be related to Pittaja Adhisara if diarrhea is predominant, Rektaja Adhisara if bloody diarrhea is predominant, Pittaja Grahani Roga if the patient presents with sore belching, weight loss, abdominal pain and discomfort, chest or heartburns when in empty stomach with or without low stools. Pravahika if tenuousness and urgency is predominant, also associated with diarrhea. Next, Ayurvedic treatment. The Ayurveda treatment includes drugs and regimens. So next slide. The Ayurveda treatment includes drugs and regimens that focuses on enhancement of digestive fiber, that is Agni Devana, so as to digest the indigested or partly digested food, that is Amapachana, thus aiming at proper digestion, also antidiarrheals, hemostatics, nutritive support, and also psychotherapy, as there are emerging evidences relating to the role of psychological factors in the manifestation of ulcerative colitis. Next, now I would set previous slides. Yes. Now, I would like to quote a case of ulcerative colitis treated in our department. Coming to the patient history, on 24th of February 2020, a 34-year-old male patient who was a non-case of IBD, ulcerative proctosigmoiditis since 2017, came with third relapse to the Shalyatandra OPD of Amrita School of Ayurveda. On histopathology, diagnosed as ulcerative proctosigmoiditis with moderate to severe activity. Next is the treatment and the diet and regimens that we have advised is depicted in this table. It includes medicines like Ishrimadu Ksheerapaga, it is a medicated milk preparation, then Dhanvantara tablet, Vilvadi tablet, Kankaina tablet, and Avipatti Churna. Also, we have advised these do's and don'ts to in his diet and lifestyle. Throughout the treatment, along with medicines and regimen, we have advised the patient to take buttermilk added with the changiri, that is Oxalis corniculata, stalks and leaves on daily basis. Coming to the results, the patient has been relieved of all signs and symptoms by about 3 to 3.5 months of treatment. The medicines were discontinued, and we have advised him to continue the buttermilk changiri drink daily. For the past 1 year, patient had never experienced relapse of the disease and is almost free from any symptoms to date. The Mayo score or disease activity index for ulcerative colitis was 4 before treatment and has reduced to 0 after 3 months of treatment, and then proper following of diet and lifestyle, and has not reported relapse in the past 1 year. Probable mode of action of buttermilk and the changiri mixture. So next slide. Buttermilk detoxifies the body and cleanses the intestine, relieves constipation, and helps to replenish intestinal flora. It has less fat compared to milk and is rich in calcium, potassium, and vitamin B12. Hence, in Ayurveda, prime importance is given to buttermilk. It is suggested as a medicine either singly or in combinations, especially in the diseases of colon, where homeostasis of digestion and absorption is inevitable. Various studies carried out on changiri or Oxalis corniculata reveals that it possesses anti-inflammatory, anti-ulcer, antimicrobial, and wound healing properties. So we have used these two in combinations here in this case. Next, coming to conclusion, Ayurveda treatment is safe, cost-effective, with less side effects and a promising alternative in the management of ulcerative colitis. Direct reference of positive effect of buttermilk in ulcerative colitis is explained in class 6. Also, the properties of changiri shows its positive effects in ulcerative colitis. From researchers, scientific data about the efficacy of buttermilk and jaggery in ulcerative colitis have been proved. So it can be concluded that buttermilk added with jaggery could be a safe, effective, and best remedy for the management and also in reducing the relapse in case of ulcerative colitis. Next, these are my references. Let's eat healthy to keep our gut healthy and our life healthy. Thank you all for your patient listening, and thank you, respected organizers of Knowledge Festival, for giving me such a great opportunity. Thank you.
Thank you very much, Dr. Shilpa. Just a great one with some real results. Maybe you can answer one or two questions. One is, do you have any idea, or is it just on the experiences that we have, why people have these issues, especially when they're 30 or 40 year or in the third and fourth decade of their lives?
Yes, sir. These decades are almost the working period of people. So there is chance of skipping their meals, lot of stress like that. The causes are explained, sir. Like nutritive is one of the etiology. So psychological.
Yeah, go on. No, so it's a lot about the stress level in those ages where you have to work and are responsible a lot for family, for the finances and everything. So that will be probably a determining factor. And also about your therapy, because we want to have some way to for our audience all around the world, those who are not at all in touch with Ayurveda or Indian medicine. Is it that when you started the therapy, how long did it take for the patient to feel any difference?
Yes, sir. By the first month itself, we got marked the results in his signs and symptoms. We don't have a post histology report or something. We just came to know the results by the patient words only, sir. Through his words, he's happy now. The treatment.
No, it's great that it can work, because you know, it's something that it seems to be going around a lot. It's also prevalent in Europe and America a lot. I'm seeing it everywhere in the advertisement and everything, for all kind of drugs and medicine that you can take, because many people who are dealing with modern medicine, they are used to take some medicine and kind of immediately they have this response, they feel better, it's less pain or something like that. The bleeding stops, whatever it is that they feel better right away. That was why I was thinking, because we saw in those tables that after certain periods, just the whole shape of the patient got better. After 1 month, I think, was the first table. But I just wanted to know if there is any data on maybe the patient came on the first day and said, I already feel better, or was it after 3 days or after maybe a week or two, or does it take 2-3 weeks until you slowly get into?
No, sir. By first week only, his like loose stools, number of loose stools got reduced. Like that, slowly and like gradually, we got the results. Sir. By third month, we were able to withdraw all the medicines, and we just advised him to take care of his diet. And also we included this buttermilk. and oxalis corniculator in his daily lives.
Very good. Thank you. That's brilliant.
Thank you.
Thank you very much. We will go on to next paper. Vinayak, who is our
Dr. Rajat. Dr. Rajat is here.
Dr. Rajat. Yes. Welcome. And let me see. We have Dr. Rajat with the role of Ayurvedic herbal mineral preparation in increasing immunity and treatment of COVID-19. Please, doctor, it's all yours.
Thank you, sir. Am I audible?
Yes.
Oh, thank you. Myself, Dr. Rajat Kumar, final year PG Panchakarma, PGM Ayurveda Medical College, Gadag, Karnataka, India. And my topic is role of Ayurvedic herbomineral preparations in increasing immunity and treatment of COVID-19 pandemic. Next. These are the contents. Next. Introduction. Today we are facing a pandemic named COVID-19, which is caused by SARS-CoV-2, that is severe acute respiratory syndrome, COVID-2, which mutates and forms the second wave. That is the second wave which is we have seen in India. WHO named the global it as a global pandemic in the March 11, 2020. It is same as that of SARS-CoV-2, which is SARS-CoV, that is seen in China in 2003 to 2004. As of now, dated 15th August 2021, there are around 20.7 crores total cases and 43.5 lakh deaths in all over the world. Next. There is no exact correlation of the disease in Ayurveda, but by seeing the symptoms and pathophysiology, we can compare this disease, whole of the symptoms. By the symptoms, we can compare it to Sannipata Jaswara, Rajayakshma, and Rasavaha, and Raktavaha, and Pranavaha Srotovikara. Next. And if you see the life cycle of SARS-CoV-2, after the transmission of the SARS-CoV-2 virus is by the respiratory droplets and aerosols, and it will bind to the host receptors by the ACE2 protein, which is present in the cell membrane, and in that it divides into two, that is slide protein 1 and slide protein 2 by the protease cleavage, and enter the host cell by the endocytosis or the membrane fusion. Enter cells, it will enter cells by of pulmonary alveolar epithelium and replication of RNA strands happens in the pulmonary alveolar epithelium, and in that nucleopsid attaches to newly formed DNA and newly formed RNA, and membrane protein mixes with the endoplasmic reticulum, and it multiplies within the cell and produces droplets, which will cause the community spread. Next. Yeah, the main thing, the pathogenesis according to Ayurveda, this is my understanding, that's all. Agantu Chakrimi, we can take it as COVID-19 virus, and yeah, then it will causes the Rakta Dhatu Paka and symptoms of Sannipata Jaswara. That is what we have seen. The first wave is the Rakta Dhatu Paka, that is Chayapurvaka Prakopa, and in the second wave there is Achayapurvaka Prakopa, and there will be no Purva Rupa in the first stage, but in the first wave there was Purva Rupa. In the second wave there was no Purva Rupa as it is, and we can see the next stage as of Sanipata Jwara and Dhatukshaya, that is Dhatukshaya or Ama is seen, and then Upadravas, that is complications, then the Para Ojakshaya, that is the main immunity factor reduced, and it will cause us the Marana. Next. I think I'm not clearly visible. Yeah, fine. Yeah, pathogenesis. As of now, in the stages of the COVID-19 disease, in according to according to allopathy, there was a asymptomatic phase. There will be an asymptomatic phase. There will be no symptoms, and followed by that, there will be invasion of the infection of the upper respiratory tract, and then there will be symptoms like fever, malaise, dry cough, loose stools, and vomiting. And in some cases, we can see the Rakta Dhatu Paka, that is the exact symptoms of Rakta Dhatu Paka, that is increased or excessive hunger and thirst in the patient, and then in involvement of the lower respiratory tract, there will be dry cough and breathlessness, progression to acute respiratory distress syndrome, that is ARDS, or there will be ARDS and chest pain. And then the second, that is Ayurvedic understanding, there is a first phase, the Purva Rupa will be seen. If Purva Rupa is seen, then there will be the excessive increase of hunger and thirst, and everything will be there. And the second phase, that is Rakta Dhatu Paka, will lead to Ama, and there the Jara, Gaurava, Tandra, Aruchi, that means the symptoms of exact fever symptoms will be seen in the second phase. In the third phase, there will be symptoms of Jara, that is fever. With that, we can see the upper respiratory involvement. There will be dry cough, and sometimes we can see the GI involvement. There will be loose stools and vomiting as well. In the fourth phase, there will be the lower respiratory tract infection. There will be dry cough with the breathlessness, and blood mixed phlegm and breathlessness will be there. In the fifth phase, we can see the we can see the complications. That is, it may be mucormycosis or anything else, or the aspergillosis, or cases of cytokine storm, which is seen after the acute respiratory distress syndrome. And all these fourth and fifth phase of these symptoms will be seen if there is a Vaidya, there is a problem if done by the Vaidya. Next. Fine. Sorry, back. Yeah. Pathogenesis, that is Sroto Samprapti, that is Dosha, which is explained, which is seen in this is Pitta Dushti. Vata Vruddhi will be there, Kafakshaya will be there, Dushya, Rasa Rakta Dushti will be there, Agni, Jatragni will be hampered, and Ama, Jatragni and Dhatu Agni Janyama, Srotas, Rasavaha, Raktavaha, Udakavaha, Pranavaha, Srotas will be involved, and Sroto Dushti there will be ati pravritti, that is excess, and vimarga gamana, the movement in the different directions, and adhisthana, that will be the amashya, will be the adhisthana, and uddhavasthana is pranavahasrotas, and roga marga is the madhyama, and vyaktasthana is sarva sharira. Next. Yep. Pathogenesis, that is the mainly the symptoms and signs what we can see in the COVID-19 disease. There is symptoms, we can see fever, body ache, dry cough, breathlessness, loose stools, vomiting, chest pain, and sore throat. The signs we can see in the patients, that is lymphopenia, hyperventilation, hypoxia, shortness of breath, and ground glass appearance in HRCT. And next, that is complications. We can see that many of the complications like respiratory system involved complications like ARDS, acute respiratory failure, and sometimes it may affect the other systems as well, like mucormycosis, which is affecting the eyes, and cytokine storm, and aspergillosis, sepsis, and pulmonary embolism, acute liver and kidney injury. Next. Yeah. Treatment. We can give treatment to the COVID-19 disease with the in Ayurveda with the two aspects, preventive and curative. With this, we can divide that. Preventive as a whole is a immunity kind of thing, and then curative is that what we are giving to the to cure the COVID-19 patients. Next. Preventive, that is Jata Karma Samskara, which has been explained in the Hindu scripture or any of the Ayurveda scriptures, that has been explained in the Sushruta Samhita. Jata Karma Samskara is a samskara which has been explained after the Navinala Kartana, that is the umbilical cord cutting. After cleaning the body, we should do the samskara, that is by adding madhu, that is honey, ghee, and anachurna, or the gold, mainly the gold preparations which is bioavailable in the body is incinerated gold, or the bhasma of the gold, and that we are giving to the baby as a lickable on after the umbilical cord cutting. Next, the second one is Swarna Bindu Prashana, Swarna Prashana Samskara. I won't tell Swarna Bindu Prashana because, and one more thing, Swarna Prashana Samskara is it has been told for children as well as adults. Children has been explained by the Kashyapa Samhita, which has been explained in with the three ingredients: madhu, that is honey, ghee, and Swarna Bhasma. And after that, with the Swarna Bhasma, you can add the churnas of Brahmi, Manduka, Parni, Trifala, and Shatapushpa, Chitraka, Shatavari, etc. And in adults, we can give same type of Swarna Prashana with the same adjuvants, and but in the different doses. In the normal doses of adults is 1/8 to 1/4 Rati. That means it will come around 15 to 30 mg of in adults per day. And in pediatric cases, till 5 years, we can give 1 to 3 mg. And in 5 to 10 years, we can give 3 to 5 mg. And in 10 to 16 years, we can give 5 to 10 mg. As the explanation of the Swarna Bhasma or the that is gold preparation, we can see a very good textual reference of Vagbhata. That is, if you give when a person is given sorry, yeah, next one. Curative, it can be divided as curative in presence of upadravas, treat them, and next is Raktadhatupaka, treatment of the instant increase of immunity, a treatment in post-COVID stage. For all patients, the treatment principle is same, but the medicines will differ from one another, which is selected based on the yukti of the physician or the intellectual of the physician and the prakriti of the patient. Treatment should be there to break the pathophysiology, not just to reduce the symptoms. Next. Yeah. There comes the herbo-mineral preparations, which has been explained, that is curative as a whole. The what we can give in the upadravas, especially in mucormycosis cases, what we have seen in this area, we can use Gandhaka Dhruti, Gandhaka Rasayana, Tikshnanasya, with the Karpa Sastyadi Taila, etc., and Jalo Kavacharana, and in Rakta Dhatu Paka, that is the first stage of the treatment. We can see, we can give the Rakta Pachaka or the Shodhaka drugs like Mahamanjishtadi Kada or the Patola Katuro Hindyadi Kashaya, etc. And we can do Siravyadha in the Vamabahu Siravyadha, and the next in the Vishagarbha, we can give the herbo-mineral preparations like Vishagarbhavotali, Shilagarbhavotali, and Pravalagarbhavotali, and then the treatment to increase the immunity when patient is having the COVID-19. We can give the Hemagarbhavotali, as well as it will increase the immunity, as well as it will cure the disease. We can give the Hemagarbhavotali, Abragarbhavotali, Ratnagarbhavotali, and Purna Chandrodaya Makaradvaja, and Nagarjuna Abra Rasa, and Samira Pannagarasa, Rudroga Chintamani, Jayamangala Rasa, Swarna Malati Vasanta Rasa, Trilokya Chintamani Rasa, Godanti Bhasma. All these are rasa preparations, that is herbo-mineral preparations. There will be some amount of mercury and the sulfur in it, and some other churnas, bhasmas, or the incinerated gold, or some kasisa, that is tutta or copper, etc., will be there. And Swarna Prashana, by the in the post-COVID stage, we can give the immunity increasing. For the immunity increasing, we can give Swarna Prashana by the Sushruta. That is what I have told in the adults, what we can give the Swarna Prashana. And the next one is Shuddha Gandhaka Prayoga by the Somadeva. Next. Yeah, discussion in the medicines explained in the medicines explained. Samira Pannagarasa has a good effect in the cytokine storm. What you can see in the immunocompromised patients, we can see the cytokine storm. Samira Pannagarasa has a very good role in reducing the cytokine storm. By seeing the symptoms of both the waves, they may be considered as first wave as a Rasavaha Srotovikara and the second wave as a Raktavaha Srotovikara. And next one. Next. Conclusion. The COVID-19 disease is an unprecedented pandemic situation. By this study, it confirms that we can break the Samprapti with the help of Rakta Pachaka and Siravita treatment and herbo-mineral drugs to increase the immunity and cure the COVID-19 disease. Treatment should be patient oriented instead of disease oriented. That's all. Thank you. Next. These are the references. Thank you.
Thank you very much. Thank you. That was very clear and structured, especially for Ayurvedic doctors who can now take these informations and basically put them to work. I mean, it was very scientific from an Ayurvedic point of view, so I will not ruin it by making any simplistic questions, and we will just thank you for your work and for the time you took to do this presentation for us. Thank you very much, Dr. Raj.
Thank you, sir.
So Vinayak will go to the next paper, which
Dr. Karin Ramya.
Yes, yes, I'm here. Good evening.
yes. Hello, welcome. We will hear a paper on a review on immune boosting effects of pharmacological action of Camarasi Carapam. All right, then. This is from the Siddha section. So go ahead, it's all yours.
Thank you. One and all, a very good evening to one and all present here. Today, I'm going to talk about a review on the immune boosting effect of the pharmacological action of Camarasi Carapam. I'm talking from Velumari Siddha Medical College and Hospital, which is located in Chennai, and my name is Dr. Karina Rema. Next slide, please. Yes. Today, we're going to talk about an important quote in Siddha aspect, which was told by Satamuni. The quote name is Andathil Ullade Pindam, Pindathil Ullade Andam. Now, the meaning of this quote is what is in the microcosm is in the macrocosm, and what is in the macrocosm is in the microcosm. We'll learn about the meaning after some time. Now, let's see the second quote. Soundness in health reciprocates the wellness of mind. Here, the health is indirectly connected to the mental health. This was written so many centuries ago by Tirumular in the book of Tirumandram. Here, he is also given the definition of body. A body is a sacred instrument to contain the soul, therefore must be nurtured well to safeguard the life. So it also talks about the definition of the body. Next slide, please. Okay, today we see about the introduction. Siddha is the mother medicine of the peninsula southern India. Not only Tamil, it is about the mother medicine of the Dravidian of southern peninsula India. Now, let's talk about Siddha. Let's see a background about Siddha. Here, we are going to talk about the Siddhas. Based upon that time, we see that the Indian culture had a supreme time. They had so much of development of consciousness in Indian, the consciousness back then than we compare to here. They didn't have any they didn't have so much of medical equipment or any other type of items to find out the basis of the disease or how to find out and to find out the medical composition or the formulation, or to find out what is the disease and how to give it a solution. But they had a connection to their soul. So they had the creative mind and they had a connection to the knowledge which is connected to their soul. So they have a
Sorry, go on. It was just another mic went on.
Yeah, okay. So as I was saying before, they had a connection between the soul and the mind. And the creative thinking was so kind and so good that they had so much of knowledge that they could find out a disease and the final complication, the herbal mineral formulation, to give an explanation to that disease, and to even find out a formulation to cure that disease back then itself. And now we are just finding out about that, and we are learning that, and we are applying that in our day-to-day life. Such formulations of that immunological and immunomodulatory drugs are used in the present scenario, and they are evident to such current researches. These immune boosting and immunomodulatory drugs are so implemented even in COVID-19. So they have such creative mind, and they had such wisdom to do this. Okay, now we see about the word Siddha. The Siddha means, the word Siddha means established truth. Now, the fundamental principles of Siddha, which is the basic of Siddha, is made up of 5 elements, which is also known as Aimbudam, 3 forces, which is known as Mukutram, and 7 constituents known as Yelu Udar Kattukal, also known as Yel Udar Sadhukkal. Now, the Siddha medicine research is known as a bedside to bench, and the meaning of this quote means that Siddhas have already found out a medical formulation, and we are just applying it in the clinical research aspect to find out how it is applied in our day-to-day life and how to apply it to the clinical practice and give them as a disease contribution. But in the other aspect, when we talk about bench to bedside, we can take about modern medicine, where they find out a formulation and they apply it in the clinical research. They apply it in the clinical. They go through the clinical research, and then only they apply it in the clinical practice. Okay, next slide, please. Now we talk about Kaya Karpam. Siddha medicine have, there are many more Siddha medicines which are applied in our life, and Siddhas have introduced many medicines. In that, we are going to talk about Kaya Karpam. A Kaya Karpam can be also taken as a preventive medicine, and it is also known as an ambrosial medicine. Ambrosial medicine, the word ambrosial means immortality, which is also known as longevity. Because that immortal medicine can be, the one's prepared medicine can last for a long time, which is for a long time. It can be eternal. We can say it as eternal. So the Siddhas use this medicine to protect the body from demise or decomposing position to increase the life expectancy. We will see it in the next slide about the Kaya Karpam. Now, the goal of this work, we are doing just a review paper, and we expect people to take this into preclinical and clinical trials, and to have an experimental proof, and to take about this in the upcoming future, and to know more about the immunomodulatory action of Kavarisi Karpam. Next slide, please. Okay, here we see the ancient medicine that these people, you see in this picture, they are the Siddhas. Okay, so these people were known to be the seer or thinker of men of action. They, as I've said, already mentioned before, they had so much of knowledge, and they had so much of creative mind and wisdom that they had a connection through their soul and the knowledge through which they could already, have that evolution of the first 10 faculties through which they could find out a formulation, and they could cure people with their, their hands, and with their medications, and with the herbs. Next slide, please. Now we see about the 7 body constituents. As I mentioned before, there are the Mukutram, the Panchabhudam, and the Yelu Udar Sadhikal. They are the basic fundamental principles of Siddha. Here we are going to talk mainly about the Yelu Udar Sadhikal, also known as 7 body constituents. We are going to see about them one in one. The names are Saram, Tennir, Oon, Kolpu, Yenbu, Mulai, Sukkilam, or Suronidam. Saram is known as the digestive juice, Tennir as blood, muscle as oon, Kolpu as fatty acid, Yenbu as bone, Mulai as bone marrow, and Sukkilam as semen, and Suronidam as ovum. Next slide, please. Now we see about the Kaya Karpam. Kaya Karpam is nothing but the competent body. You can take it as a competent body in the English formulation. Here, the Karpam can be taken as a preventive medicine which heals, rejuvenates, and balances dry humor. It not only restores youth but also maintains usefulness. Hence, we take this as a longevity, hence an ambrosial medicine, like I said before. Here, there are 2 types of Karpam, which is known as Podu Karpam and Sirapu Karpam. Now we are talking about Podu Karpam. Podu Karpam means which can be used as a prophylactic medicine, which is a preventive medicine. You don't need a disease to take this medicine. It can be used as a preventive medicine, which means you can take this even as your day-to-day healthy life. But you can take it only for a period, which can be either 40 days or 48 days. The medicine which we're going to talk about, which is Kamarisi Karpam, which can be taken as a period of 40 days. Now, what is the best time to take this medicine? It can be taken after meal, both during mornings and evenings. Next slide, please. Now, This is drugs which are involved in Samarasikarbam. First one is known as Neringil, the botanical name which I've given here for easier understanding, which is known as Tribulus terrestris. And the part used is the seeds. Now, Nellikai is also known as Emblycophis nalis, and the parts used are fruit. And Sindel here is genus Cordifolia, the parts used are bark. Next slide, please. Now, we're going to see about the procedure. Now, the Neringil, which is also known as Tribulus terrestris, we are taking the seeds here and the fruits of the Emblycophis nalis without the seeds, and the Sindel, which is genus Cordifolia, and the part we're using is bark, like I said before, but without the skin. We're going to peel off the skin, we're going to take off the seeds, and we're going to take it in equal ratio, and we're going to grind them. With grinding them, then after grinding them, then we get a fine powder, and we're taking them and we're storing it in a container, and then we are adding cow's ghee and honey. Then we are going to eat them. Okay, when we are going to take them as a medicine, we're going to add ghee and honey to this, and then we're going to take it in with 6 to 8 grams, and we can take it in the morning and evening. Like I said before, we're going to take it after food. Then after this, we're going to take with milk. Okay, so we are going to have a followed by milk intake. Now, indications. Now, it is used mainly for immunity, aphrodisiac, general tonic, and prevention of debility. Like we are using this right now for immunity aspect, and then we're going to see why we have mentioned about aphrodisiac and the prevention of debility and the general tonic in the later slide. Next slide, please. Okay. Now we're going to see about the basics of Siddha. Now, here we have talked about the 5 elements. Like I said before, Andathil ullade pindam, pindathil ullade andam. We're going to see about the explanation of that. What is in the microcosm is in the macrocosm. Now, about the 5 elements, which are nothing but the earth, water, fire, air, and ether, we're going to relate it to our real life right now. Now, these 5 elements, you can see it in our real world, like the food we eat, the water we drink, the air we breathe, the land we live in, and the force which holds the earth together, and through that we are living here. So these are nothing but the Panchabhut, which is the 5 elements. Now, these 5 elements can be explained to our body too. So we are made up of this Panchabhutam, and even the world is made up of this Panchabhutam. Hence, microcosm. What is in the microcosm is in the macrocosm. Our cells are made up of body. A body is made up of cells, and the whole world is also made up of cells. Now these 5 elements can be related to the 6 states in the body. Here we can see that the 5 elements is linked with the 6 states by the combination of 2 elements. For example, we can see that the sweet is equal to earth plus water, which we can talk in Tamil as Inipu is equal to Man Kutal Tanneer. Man Kutal Neer. Inipu na Man Kutal Neer. Okay. So like this, there are about 2 constituents, combinations of each 5 elements, each 2 of the 5 elements which are combined to each state. So this is how the 5 elements are combined to the 6 states. They are interlinked. Now, the 6 states are interlinked to the 7 body constituents. These constituents are maintained to produce a healthy offspring, which we're going to talk about later. Okay. So the imbalance in this body constituents is cured by the 6 primary states, which is here with the 5 element theory. I hope you can understand what I'm saying. I'll repeat it again. The imbalance in the 7 body constituents is cured by the 6 primary states with the 5 element theory. Okay, the 7 body constituents which are made up of in a body. Okay, the next slide, please. Now, this is a flow chart which you have to understand like slowly, like what I'm saying. Now, like I said before, the Tribulus terrestris here, Emblycophis nalis, and Xenospora cordifolia. Now, we assign particular tastes. There are particular tastes to each plant, okay, in the world, and through this we are giving medication to each formulation, and through each formulation and each diseases, and that is how we assign diseases, formulations to each diseases using this aspect. Here we are saying Tribulus terrestris, also known as Neringil. Here, this Neringil has the astringent taste. Now, this astringent taste is linked to the 7 body constituents by blood, which means that the astringent taste can be used to increase the blood in our body, And the particular, the triplet steresis, in the triplet steresis, there is a phytochemical component through which also we are helping to, connect to you through a modern aspect, which can help you to understand how this works in the Siddha work, in the Siddha basis and in the modern basis. Here, the ferulic acid here, it applies to the blood through the increase of erythropoietin. You can see this. We will see it in the next slide that the ferulic acid here can help to increase the erythropoietin, which is a protein required for the increase of the RBC production, which is also known as erythropoiesis. In the same way, quercetin and berberine are also applied in a respective manner. Here, the Emblica officinalis, also known as Nellikai, has a sour taste which helps to increase the fatty tissue. Okay, through the increase in fatty tissue, this can be done by the phytochemical compound known as quercetin, which is present in Emblica officinalis. In the same way, Seedal has a taste bitter in the Siddha aspect, which helps to increase the bone marrow content of the body, and the phytochemical compound present in Tinospora cordifolia is berberine, which helps to increase the bone marrow. Thus, the sweet and the phytoconstituents and the 7 body constituents are related. Next slide, please. Okay, now we're going to see about Pathyam. You might ask, what is Pathyam? Pathyam is nothing but the diet regimen. Okay, when we follow any karpam or any karpamure or any medicine, especially in Siddha, we follow a particular diet regimen or particular aspect of food while we follow it. So here, why do we follow it? You might ask, why do you follow it? It is to increase the efficacy of the drugs which we take, which can help us to live a long and healthy life. Hence, ambrosial medicine. Okay. So here we see that the milk, raw white rice, which is white rice, and green grams can be taken. So this can help to increase the efficacy of the drugs. So this, especially these three food items can be taken to increase efficacy of the drugs. And the next slide, next point. Here we see that the tamarind, salt, meat, fish, etc. can be reduced, can be avoided or either be reduced to, which can help to increase the efficacy of the drug. And so that's the medicine can hereby have a faster cure in the body. If it is taken as a curative medicine, the medicine can can help to have a faster aspect in the body condition, and thereby it can give a faster cure. Then the sexual abstinence is also advised. It can be advised, and for a 40 days period. Next slide, please. Now we see about triplet steresis. In triplet steresis, we are taking the seeds. You might ask, why are we taking the seeds? According to an Siddha aspect, the seeds tend to consist of the 5 elements all together in the particular seed. There are certain specific budams, which is 5 elements which are assigned to each part of the plant. For example, water is assigned to the stem part of the plant. In the same way, each leaf, fruit, and each and everything are assigned particularly. Here, the seeds are assigned to consist of all the 5 elements in this seed. So hence we're taking triplet steresis seed. Hence the triplet steresis is also known as Nelli, which is also known as Kamarasi. Here we are taking the main aspect as the Kamarasi. So hence we get the name Kamarasi Karpam. So triplet is the main component here. I'm going to see its actions. It has antidiuretic, diuretic, aphrodisiac, and immunomodulatory actions. Now we're going to see about the phytochemicals and their aspects. Now the harmine. Harmine is considered to have an osteomodulatory response which occurs during the inflammation. During the inflammation, it helps to increase the osteogenesis. So during an inflammation process, the osteomodulatory response is very much required. Thereby, it helps in the osteogenesis. Now we're going to see about MAO inhibitor. MAO is nothing but monoamine oxidase. This monoamine oxidase inhibitor helps to elevate the happy hormones, which is nothing but serotonin, dopamine, catecholamines, etc. Now, monoamine oxidase is said to inhibit or reduce the level of the happy hormones, thereby which helps to cause the mood disorder. Now, harmine acts as an MAO inhibitor, thereby elevating the happy hormone, and thereby our general mental health is developed. Now, we said in the first slide that the sound health begins from the wellness of mind. So, we can apply that here. Now, about the angiogenic inhibitor. Angiogenesis is a process through which there's a formation of new blood vessels to begin a new tumor or to develop a new tumor. Here, angiogenesis can be also taken as an anti-cancer or tumor. They form the development of anti-cancer or tumor effect. So this angiogenic inhibitor of harmine helps to decrease the amount of vascular endothelial growth factor or inhibit VEGF, which helps to increase the angiogenesis. So, reducing the level of VEGF reduce the process of angiogenesis, thereby acting as an angiogenic inhibitor. Okay, that's about it. Now about protodiazine. Protodiazine helps to increase the DHEA. DHEA is nothing but dihydroepiandrosterone. This dihydroepiandrosterone is produced in the adrenal gland and helps to increase the estrogen and testosterone levels. This is estrogen and testosterone levels also help to increase the immune system of the body. So it not only helps in estrogen and testosterone, which are the male hormones or the female hormones, and it also helps to increase the immune aspect of the body, thereby helping in anti-aging and general sense of well-being. Now we are going to talk about ferulic acid. Ferulic acid is used in the process of respiratory burst. Respiratory burst is a process which helps to increase the amount of the pathogen, about the killing of the bacteria or microbes by increasing the amount of reactive oxygen species, also known as ROS. So the increase in the level of ROS helps to kill the bacteria or microbes which enter the body, thereby increasing the through the process of IgM production. IgM production is the first line of defense during the immunomodulatory action. So IgM is increased first, followed by the increase of the cytokines or white blood cells or whatever it is. So first action is IgM production, and ferulic acid of the triglycerides helps to increase this. Then it also helps to increase the erythropoietin. Like we have seen before in the 7 body constituents flow chart, ferulic acid helps to increase the erythropoietin, thereby it helps to increasing the RBC production. So it helps in the 7 body constituents flow chart. Okay, so it helps in the erythropoiesis. Now it also helps to increase the growth hormone. It elevates the growth hormone. So how does it do that? It helps the increase in nutritive and enzyme digestibility. So how does it do that? So when from an infant to becoming an adult or an elder person, we have different type of food we eat or different amount of food we eat. When we are a child, we eat in low quantity, and when we are an adult, we eat in a high quantity. So this intake of ferulic acid of the triglycerides help to increase the nutritive and enzyme digestibility. So we'll have a better body, a better mind, and a better soul. So it helps to increase the growth hormone. So testosterone D, it is a steroid saponin which helps to increase the apoptosis of the cancer cells, because the cancers cause the mutation, and the mutagenicity of the proliferated cell helps cause defect in the body. So it helps to induce apoptosis in tumor, thereby helping the immunity. So on the whole aspect, TTCs tend to have more steroidal saponin, which helps to increase the tumor suppressor protein. So increasing the tumor suppressor protein plays an important aspect in the immune system of the body. Next slide, please. Thank you. Now we are going to see about the Umbilica officinalis fruit. This fruit, why do we take the fruit? Because it has so many amount of actions. It has the anti-inflammatory, cytoprotective, antioxidant, and immunomodulatory properties. We're going to see about the phytochemicals. Here, the gallic acid tend to increase the serotonin and catecholamines, especially epinephrine and norepinephrine. I think I've already told this before, which tend to be the happy hormones, like we call it as the happy hormones. These tend to elevate the mood and reduce the oxidative stress of the body. So this gallic acid tend to increase. Now we are talking about the ellagic acid. Ellagic acid helps in the cancer cell apoptosis. How does it help in the cancer cell apoptosis is by repairing the chromosomal abnormalities in the body and suppressing the gene mutation. So mutagenicity of the gene of the proliferated cells causes cancer cell issues, and therefore to repairing the chromosomal abnormality can totally stop this process. So hence ellagic acid is much required in the body. Now we talk about apigenin. Apigenin help to reduce the NFKB activity in lungs. What is NFKB? It is nothing but a transcription factor which is much required in the immune system, in the immune process. NFKB is the nuclear factor kappa B transcription factor. Why is it particularly located in the lungs? Because it has an organic, it has a systemic aspect, and it works in a systemic process. Here, apigenin mainly acts for asthma. It during a normal asthma, increased NFKB transcription factor is caused by the increased inflammatory cytokines. Thereby, it causes this inflammation in the apigenin in the asthma and of the alveolar sac, and thereby causing the asthma. Here, the apigenin helps to reduce the NFKB activity in the lungs. Thereby, it can reduce the inflammation and thereby helping in the immunomodulatory aspect. Now, we talk about the ellagic tannin. Before going to ellagic tannin, I would like to talk about apigenin, quercetin, and luteolin. These three aspects of the present in the umbilical officinalis help to prevent the pancreatic injury by the NFKB, which is the nuclear factor kappa B transcription factor. Also, apigenin and luteolin, it also helps to increase the autoreactive part of the T cells. This apigenin, quercetin, luteolin, all are present in the umbilical officinalis, and they act as a clump. They act as together to help in the preventing of the pancreatic injury or helping in the increase of the T cells. Okay, now we talk about ellagic tannin. Ellagic tannin is converted to urolithin. So this urolithin is consumed by the gut microbacteria or the gut microbiota and helps to increase the aspect of the prevention of colon anti-cancer effect. Thereby, ellagic tannin helps to increase the growth of gut bacteria, which is the good bacteria. Now, pyrocolol. Pyrocolol helps to increase the DAX expression. Like we've seen this DAX is an apoptotic protein. This PAX is increased and helps to cause the apoptosis. So pyrocolol helps in umbilical officinalis helps in this aspect. Next slide, please. Thank you. Now we talk about Ctenospora cordifolia. In the Ctenospora cordifolia, we are taking the bark portion, or the bark of the body here of the stem. Now it has an aspect of immunomodulatory, anti-diabetic, antioxidant, hepatoprotective, and memory boosting properties. Ctenospora cordifolia also has a name called Amirthavalli. Here, Amirdam also means immortality. So this drug is mainly used in Karpam aspect, like we've seen in everywhere. Ctenospora cordifolia doesn't have any negative aspects that not much, we've seen so many things about so many good aspects about Ctenospora cordifolia, and is used on as an anti-cancerous drug also. Now we'll talk about its phytochemicals. Arabinogalactan, which is present in Ctenospora cordifolia, helps to tolerate the endotoxic shock. Like we talk about endotoxin first. Endotoxin is nothing but the toxin which is released from bacteria or any microbe. So to tolerate the endotoxic shock, what does it mean is that in endotoxic shock, we'll get fever or inflammation or any other aspect. So during which occurs in a sudden motion. So arabinogalactan of the Ctenospora cordifolia helps to tolerate this, thereby helping in immunity. Now we'll talk about palmitin. Palmitin, in the palmitin aspect, let's talk about its physiological aspect. Here, acetylcholine esterase and butyrylcholine esterase. They are normally the work of this ACH and butyrylcholine esterase are to inhibit the neurotransmitter. So the palmitin here helps to inhibit the acetylcholine esterase and butyrylcholine esterase, thereby helping to increase the acetylcholine, which is the neurotransmitter, which thereby it helps in the cognitive enhancement. So palmitate normally helps in cognitive enhancement by increasing the level of acetylcholine production. Okay. Next, the point is about improved antioxidant enzyme activity. What are the antioxidant enzymes? It is nothing but glutathione, superoxide dismutase, and catalase. So these enzymes, what are their functions? The function of these enzymes is to attack and destroy the environmental carcinogens. So to attack and destroy the environmental carcinogen, we can talk about skin lesion or skin cancer or skin issues or whatever it is, or many more environmental carcinogens. We can just think about it and we can get so many. So it helps to improve the antioxidant enzyme activity, thereby helping to prevent so many environmental issues which occur in our body. Now we talk about berberine. Berberine helps in the inhibition of COX-2. COX-2 is nothing but cyclooxygenase activity for colon lesion. COX-2, what is the function of COX-2? COX-2 is the cyclooxygenase which occurs due to the prostaglandin-induced inflammation. So, to suppress the inflammation, we need to inhibit the COX-2 activity, and which can be done by berberine of the Tinospora cordifolia. Now, on the whole aspect of Tinospora cordifolia, it also has an important function. About hepcidin, there's a hormone called hepcidin. This hormone helps to inhibit the iron absorption. And this, how does it inhibit the iron absorption? Is by during the inflammatory anemia condition, this iron absorption is even more inhibited, which caused by the pro-inflammatory cytokines in the body. So this Tinospora cordifolia, this intake of Tinospora cordifolia can help to increase the hepcidin, thereby decreasing the cytokines, which helps into elevate the iron absorption. So decrease of the hepcidin can stop the iron absorption. To increase in the hepcidin can increase the iron absorption, thereby reducing the cytokines of the body and thereby elevating the iron absorption. Next slide, please. Now we're going to see about the flowchart. I hope everyone can see this flowchart. So this is a flowchart which depicts the immunomodulatory pathway in which Kamarasi Katpam has a phytochemical influence on immunity. This normal flowchart without the dotted lines, we can see that it is a flowchart of our immunity. How does our immunity play and role in our body, and how does it act, and how does it increase the amount of the T cells in the body? So here we see the pathogen. It acts. How does a pathogen act in our body? So how are we exposed to the pathogen? When we are exposed to a pathogen, this pathogen, when it enters our body, it tends to increase the monocyte level, and which converts to macrophages, and thereby it increases the TLR response. On the other side, it causes lysosomal fragmentation. We'll talk about it later. Now we'll talk about the TLR. TLR is nothing but the toll-like receptor. So this monocyte is converted to macrophages, and it increases the toll-like receptors of the body, and which increases the IKK, which is the IKB kinase phosphorylation. This IKK increases the NFKB, like I've mentioned before, nuclear factor transcription, kappa B acceleration. So this increase causes the pro-inflammatory cytokines and chemokines in the body, which helps in the activation of other macrophages, which is also known as chemotaxis. This process of chemotaxis helps to call out all the macrophages, and they cause the immune response in the body. So on the other side, it causes lysosomal fragmentation. The fragmentation of the lysozyme causes the major histocompatibility and compatibility to cells to activate. So when it activates, it causes the naive T cells to activate and causes the cytokine signaling. So through this signaling, it causes to all the T cells of the body, the T regulatory cells and Th cells 1, 2, 3, 7, everything it gets activated, and through that we get all the immune response of the body. Now this is the normal immune flowchart. In this flowchart, we have included 2 or 3 phytochemical constituents of the Kamarasi Karpam, which is 2 constituents of Neringil, 2 constituents of Nellicai, and 2 constituents of Sindel. So we are showing how does it act in the immune system. Here, first we are talking about Neringil. Neringil is nothing but Kamarasi. So in Kamarasi, We'll see the harmon, which is on the right side corner. No, it helps to increase the T regulatory cells in the body. So this causes, this also plays an important aspect of the immune system. Here we can also see ferulic acid Ibd, which inhibits the part of the Th2 cell types during a particular aspect of the body, you know, which is done in another aspect. Now we can also see about the umbilica officinalis, which is Nellicae. In Nellicae, we see the gallic acid. Gallic acid can increase the amount of macrophages. On the other hand, even Sindel of cordial phytochemical of the Sindel can increase the monocyte or the macrophages conversion to stimulate the other response of the immune system. Here, even pedunculagen of umbilica officinalis and alpha-D-glucan of Ctenospora cordifolia, also known as Amardavali or Sindel, can help to increase the cytokine, pro-inflammatory cytokines of the body and lysosomal fragmentation of the body, thereby helping in the immune system. Next slide, please. Now we have come to the end of this session. Here, Kamarasi Karpam, especially Karpam, we see that Karpam, the Karpam medicine are not only used just for aging, you know, prevention of aging or stress, but it also helps to maintain wellness of the body and immune enhancement and neurotonic. Like I've said before, it can be used as a preventive medicine, not only as a curative medicine. So you don't need a issue or any problem to use this medicine. It can be used to just for a normal, just as a normal, on a normal basis, on a daily basis, for a particular period of time, like I said, for 40 or 48 days. It can be taken to increase the wellness, immune enhancement, and neurotonic. On the other hand, Karpam is also used to treat various ailments of the body. So it can be used for immunity, body strengthening, and act as a prophylactic medicine for disease prevention. So we can see how Kamarasi Karpam has an amazing role in our body. And next slide, please. So these are the references. I first thank you so much for giving this wonderful opportunity. Thank you, Open Attempt. And I hope this can help to develop Siddha in an international level. So thank you.
Thank you. Thank you very much, Dr. Karen Raima. That was a powerful presentation. Great one. You took us through the whole chain of knowledge. I'm so happy to have this amount of real well done papers here, which can give us kind of the right points of view to understand the systems. So thank you very much for your time and for the work you put in. Without any further breaks, we will go into the discussion round with our guests. We have here for the discussion, we have Dr. Shenoy, I think, yes, yeah, right?
Dr. Shenoy, yes. Namaste, sir.
Greetings.
Namaste, sir. Namaste. Thank you. Namaste.
Welcome. Welcome.
Good to see you.
We also have
Dr. Mini Mehta.
Dr. Mini Mehta. We're not sure. We have to look through. Yeah, Dr. Mehta, Mini Mehta is has just come in, I guess.
She's in the other one, 971.
No, she has come actually, Dr. Mini Mehta.
No, she just came in and she's still has to be unmuted.
You can see my window 971611.
971611 is her number.
Yes, sir.
Oh, okay. It's a double feature. Nice, nice. Okay, no.
Dr. Karen, I think Dr. Meena Kumari was supposed to come. I don't think she will make it. So if you can stay back from the Siddha side, we'll be happy actually.
Yeah, sure. It's a pleasure.
Thank you.
Great, great. So let's jump right into it. I want to just put out a question and then I go from one to the next and would like you to give us a point of the point of view of your system on this question. So the first question we have here is because we heard several ways to determine which medicine is the right one for a patient. So some take the symptoms, some take the balance, some. So just let us know what is in your system the logic behind choosing a medicine for a particular condition. So let's start with Dr. Mehta, whom we found under that other name. So please, doctor, go on. So what is the logic behind choosing medicine for a particular condition?
In our system of medicine, we treat by choosing a medicine which has the potential of causing the same set of symptoms in a healthy organism, which it has to treat in the sick person. So there has to be a law of similar, because what we believe is that what can cause a certain set of symptoms, like a poison, in minimal quantities, it can only cure that situation because the body has susceptibility to the same thing. So we treat via similars. So this is our principle behind the treatment, how we go for treatment.
Very nice. So actually you're taking a healthy body and then you're kind of comparing the healthy body to and the situation of a healthy body, and you do that to
for example, I would tell you, like we all are aware of Jenner's vaccination. It has
Right.
got the same principle. What you found that people who were having the cowpox did not suffer from the smallpox. Why? Because these two diseases are similar. So if a stronger disease is for a time being temporarily inducted into a body, then a weaker disease cannot enter. So with the disease which is artificially made is always powerful than the natural disease. So when they inoculated people with the cowpox scab thing, then they didn't get the smallpox. So that was only the most functional and successful model of vaccination. Later on, they forgot the way to choose to take a similar thing. They always prepared something from the same thing, which never worked and did wonders with immunity.
right. Okay. Okay. So just for me, because I'm trying to see. So what is the medicine in a certain case? Let's say someone comes to you and they have a flu, or they have some sort of ailment, a normal ailment. They have some kind of stomach ache or sore throat, whatever it might be, what you would like to go into.
Like I will tell you, what we do is, when somebody presents us with a symptom, like they will say, oh, doctor, I've got food poisoning.
Right.
So I will say, how is it affecting you? Both, like a family has eaten somewhere and everyone is getting affected in their own way.
Right.
Somebody is having vomiting within 2 hours, somebody has got diarrhea within 2 hours, somebody is fainting. So that depends upon the susceptibility to that poison. So their symptoms will tell me that which medicine I have to select, because we have a lot of plant remedies which we have already proved in healthy human beings. And there are so many metal remedies which we have proved in human beings. When it was given in healthy human beings like arsenic, they started to have, bitter taste in the mouth, frothy vomiting, spasmodic pains, watery diarrhea, and very anxious and restless person. Then I will choose arsenic for that person. And somebody says, oh, I'm feeling so thirsty, I need a lot of water, still I am not able to, feel that this thirst is quenched. So, and I'm having headache, I can't move. So there is a plant, Bryonia alba, this is the characteristic of that plant, I will choose that medicine. And somebody who has fainted and is getting cold sweat and watery diarrhea, transparent, continuous, and is in a much worse position, then I can choose a remedy, Veratrum alba, according to him. So the disease is same, but every individual is suffering in his own way. So
Okay.
according to the severity of symptoms, what is the mental sign? If somebody is saying, doctor, I am going to die, I am telling you, I won't see the sun tomorrow, then I have a remedy which has a severe death price. Who is going to tell when he is going to die? I am going to choose that medicine. Few doses will make him feel like that he never suffered. So this is how we select medicines for the people when they are sick.
Okay, thank you. That was very nice, because now I have a real idea of that. So let me go to Dr. Lakshminarayanan Shenoy to see about the Ayurvedic way to assess the right medicine for a patient.
Yeah, thank you, Vessel. But it is a very interesting question, because it looks like very simple, but difficult to answer. Because in Ayurveda, there is no tailor-made medicine. So we are having different protocols to treat a patient. As of now, I can tell 5 different protocols. The first protocol says that for a disease, we go in the form of symptomatology. And this is called in Ayurveda as Lakshminika Chikitsa. Suppose COVID-19 is there, he may not have fever, he may have diarrhea. Then I will not go COVID line of treatment. I will, because I have to see which is the primary symptom to him, whether it is diarrhea or flu or fever or cough or respiratory illness or breathlessness. For that I have to give him, because I have to select the symptom. That is called Lakshminika Chikitsa or symptomatology. This is the one protocol, and this is the basic protocol we will see. The second protocol says that for a set of disease, there is a set of formulations, and it is called as Chikitsa Sutra. So for fever, they have given one set of protocol, and they have given this intervention should follow the other. First, this should be given. Second, this should be given. Third, this should be given. So there is a principle behind that, and according to that principle only you have to give. This is called Chikitsa Sutra principle. The third one, Chikitsa Sutra says only what intervention you should give. You have to give antipyretic or you have to give anti-diarrhea, but which drug? Then it comes, which drug? When we select the drug, because we are having a set of drugs, antipyretics, we are having a set of drugs, anti-diarrheals, we are having a set of drugs which work on respiratory, but I don't know which to select. Even not only the drugs, there are formulations. There are formulations, many formulations. For fever, you will get more than about 300 formulations. But in allopathy, you will get only some antipyretic, 3 or 4 or 5. But here in Ayurveda, we don't have that thing. We are having set of formulations which may be across more than 300. Then they said, you decide the medicine on the basis of 10 principles. Desha, Kala, Agni, Prakriti. Prakriti means constitution. Desha means the region. From which region you came. Then Kala, time. For Kala means not only time, the age. For the children, pediatric age group, which medicine should be given. Because in allopathy, we are talking the medicine on the basis of per kg body weight. We don't have that principle here. For pediatric age, we are having specialized design drugs. For adult, we are having specialized design drugs. For geriatric patient, we are having specialized drug, or we can say there is a different modality. Even a single drug can be made different preparations. So suppose if I do a kashayam of a herb, it may not be palatable for a child. So what I will do is that I will make that drugs halwa like, that is sweet lehyam like preparation. So it depends. because that's why. So we are having 10 principles. It says Prakriti, the constitution of the patient. This is also important. Vata the patient different, Pitta the patient different, Kapha the patient different. So constitution also, there are 10 prescribed things are there. Based on that, I will select the drug. Suppose then, if these things are not possible for a general duty doctor, it is not possible to select. Then they have given some tailor-made like prescriptions. So that can be also. This is the fourth one that we can be given. And the fifth one is that whether you have to decide, because if I don't know the medicine at all, I don't know the medicine at all because I am a learner. Because I am a learner, I don't know this. Then they have given a set of prescriptions, because we say it starts from, because you talk about whether the digestive fire is correct, you correct the digestive power, because all the diseases are based on your capacity of the digestive power. If capacity of the digestive power decreases, the disease will come. So we say all diseases are based on the higher hyper digestive power or the lesser digestive power or normal digestive power. Normal digestive power will not cause any diseases. So we call this concept as Agni-dipana. So that learner will get time. So let him see whether we have to do the digestive power correction is needed or not. After that, he can treat. This is called the Agni-dipana Chikitsa, Dipana Pachana Chikitsa is there. After that, he can give the treatment, because that is why it is important, is that even if I give a medicine, he should have a capacity to digest that medicine. If the digestion capacity is not at all there, it is not possible to assimilate that medicine into the system, and the medicine is wasted. That's why the specialty in Ayurveda is that we don't have a tailor-made medicines. We are having different methodologies. That is what we call it as Lakshanika methodology, or Shiksha Sutra methodology, or Dashavida Pariksha methodology, or Dipana Chikitsa methodology. So we are having different methodologies, and there is no tailor-made thing that you have to go in this direction only. It is rested on the physician. Physician can take any mode of methodology, and the aim of the treatment is successful treatment. That's all. Do you want me to talk more? I think this is enough, I think.
Oh, yes, no, for this, thank you. I was just muted. For the first question, is that's beautiful, because now we know in Ayurveda you have, you told us how it's done. It's very individual and very dependent on all the parameters that.
That's why for we say Jvara is fever. We are having more than 1,500 types of medicines for fever itself. So the choice is for the physician. He has to see the condition of the patient. There are many methods are there. So I don't say, because it is entirely dependent on the physician. He can choose any medicine, and aim of his treatment is to successfully treat the patient. That's all.
Right. So yes, for our viewers, maybe there is no just aspirin or anything that you, as you said, would.
Tailor-made prescription is not there.
Yeah, that you would give to a grown-up person over 50 kilogram or 100 kilogram, 2 pills, maybe 3 pills, and to a child the same thing, just half a pill. It's absolutely an individual process, and it might be that the same person gets a different drug for the same issue at a different time, or under different circumstances, maybe even. Right? Yeah.
Right.
So that's a very sophisticated way to go about it, and it needs a lot of energy and effort to get to the right.
Individual attention is given to the patient, and the intervention is always individualized.
Right.
So for each and every patient, the treatment is different.
Right. No, that obviously takes time. So let's go on with the same question to Dr. Karen Rama with from Siddha, to see how does Siddha medicine go about. Is there much of a difference to Ayurveda, or is it similar, or how do you do that?
It is similar to Ayurveda. So basically, Ayurveda and Siddha, we can say it in our own, like we are brothers and sisters. So to talk about how to assess the right medicine for the disease, first we can talk about the tri-humor basis. Since I am still a student, I am still a UG student, I can't talk about the in clinical practice like the other amazing doctors talked about. So I'll talk about in Siddha aspect. So first we'll talk about the tri-humor basis. Like I said before, I haven't talked a lot about tri-humor basis, so I'll talk about it now. There are about the tri-humor. It is like Vada, Pitta, and Kapha. In Ayurveda topic, they will tell it like that. In Siddha, we'll tell it as Vadam, Pittam, and Kabam.
Right.
Vada, these three tri-humors are the one which are based upon the assessing the body. So based upon this tri-humor, each body are made up of in different aspects. So I've told about the tri-humor first basis. So the second one is about based upon the body. So on the body appearance, we can find out if the person is Vadam, a Vada Udaminar, or Pitta Udaminar, or Kapha Udaminar, based upon body. When the person is a Vada, is composed of Vadam or Pittam or Kabam as a dominant or recessive. So in Vadam, we will say that the person, for example, I'm telling the Vada Udaminar can be taller and slimmer. Pitta Udaminar can also be, in a normal, moderate height, and can be in a moderate weight. And in the Kapha Udaminar, the person can be either short or either tall, or he can be a fat person, or he can be a stout person, like I said before. So this based upon the tri-humor, we can determine, based upon the tri-humor and the body appearance, we can determine the N-Vagai Thervu, which is known as the eight ways to constitute about a disease. So we have a line to say Nadi, Parisam, Na, Niram, Moli, Viri, Malam, Sirinir, Ibai, Yavana, Marutuva, Raidam. So what does it mean is that based upon the tongue, based upon the skin, based upon the body, the nadi, which can be told about the nerve, how we see the urine, the feces, how we see the pulse in the body, and based upon that, and these and all depict upon the they are the tools of the doctor. So these help to determine about the person. Also, we can also determine how to find out the medicine of the person based upon even the signs and the symptoms. Like they said before, I think both the doctors told before more about that. So we can see here about through these N-Vagai Thervu. So now we can also talk about the medicine, different aspects of medicine. In Siddha, we can use there are so many medicines just for a simple fever, for example. So now, in the medicine aspect, we can say that Kapha Udaminar, like I said before, Kapha Udaminar, they won't take in Manapaga. Manapaga is made up of sugar. So, Kapha Udaminar, they are already made up of, the body is made up of sugar. So, eating more sugar can make the body, can worsen the disease condition. So, we can take instead, we can take as Kudinir. So, Kudinir is something that's made up of water. So this can help to increase more, which can help to concentrate on the disease more than increasing the kabam or increasing the weight of the body. So increasing the weight of the body for a Kapha Udaminar can lead to a disease which is worse than whatever they have right now. So, particular each, so like I said before, for just the fever, we can use anything like a Tadisari Varagam or Kapha Surukudi, Vada Surukudi, Pitta Surukudi. There are so many medicines. So we can determine and proceed with the medicine based upon the body aspect and based upon the tri-humor aspect, and through the pulse. Using the pulse, we can determine how it is, and mainly with the help of the N-Vagai Thervu. So yes.
Great, thank you. It's just when you're talking, there is some extra sound, some noise in the background, which makes it, I don't know, maybe if you can do anything about it, but if not, it's fine. very useful to know the little differences and the similarities. So let's get to the second question, which is very important for what we are doing here, because we also are trying to find a way that can be established for studies, let's say. So to find maybe new ways to establish certain ideas and get things into society. So for that, let's go through the same round again. So the question is, what's the research methodology that your system uses to study a medicine? So each system has some ways to find out which medicine is the right one for what kind of situation. And then you have to have some sort of studies, as we know some things about the ways that Western modern medicine, allopathy, is doing their research in, and we would like to know how all the other systems go about that. So Dr. Minameti, please.
Actually, can I present my presentation? I have everything, what all you want to know. I've just, put that information in my presentation. It's very short.
You want to share a screen?
Yes.
Okay.
I will give you the, so now if you want to share, you can do so. Yes. Great. You come prepared. That's great. Very good.
Right. So, Homeopathy was born as an experimental discipline, as can be seen from enormous amount of homeopathic data collected over more than 2 centuries. The cardinal principles of homeopathy include the law of similia, which I already explained. Law of simplex means the medicine should be a simple thing. It should not be a compound, a complex, a mixture of remedies, mixture of herbs given to a sick. It should be a simple single medicine. And number 3, law of minimum. Minimum number of doses should be given, and enough time should be given to the body to respond. And homeopathy is the only system where the drugs are proved on the healthy individual. So entire our materia medica is made up of about the drug proving. Like so many doctors, they took China medicines in Bonaparte, and everyone gave it to the patients, individuals of every age, both genders, small children, and they saw on the first day what it was producing, what it was producing on the 7th day. So once it was stopped, all the symptoms were removed because it was an artificial disease, and that was recorded in everybody's book, and then was matched, and a very accurate materia medica was produced. So whenever those key symptoms of those proved medicines are seen in some sick individual, minimum doses of these medicines, these proved remedies, cure the patient. And what I heard Ayurvedic people talk about, they prescribe medicine according to the state of the patient, according to cough pravritti, according to this. When we go to deal with chronic disease, we also have a theory, and we treat people on the basis of psora, psychosis, and syphilitic. We believe there are 3 types of miasms. Miasms means disease-causing organisms, or miasms means obnoxious agents in the body, which should live in a balance. So psoric personalities are the personalities which are very nervous, which who like movement, and they're very thin people. Easily you can, they get fearful very easily. And psychotic people are the people who are stout, very, they are overweight, and they are the planners. They can plan anything, and mostly like film directors. They are huge people with a lot of planning in the mind. And syphilitic are the people who are destructive, who easily get angered, who like terrorist kind of people. Syphilitic means if they are going to be religious, they are going to be religious people, that they are going to, kill or die for the religion. So these kind of people are syphilitic personalities. So when these kind of people fall sick with the same kind of influence, they have different reactions. Syphilitic person will have destructive diseases where they will have the organ damage. Psychotic people will grow out tumors or retain water in the body. And whereas the soric people will suffer from deficiency syndrome. So this is how we identify and categorize people, and we have remedies: antipsychotic, antisoric, and antisyphilitic. We also don't have any pre-prepared medicine for a person. We have to see, but in acute diseases we just see the most prominent symptom which has to be treated, the state of the person. Whereas when we go and treating the chronic disease, then we see a lot of things in the patient, lot of history since birth. What was the first disease he suffered from? How was the mother during the whole time of pregnancy? Was she sad, or she was jealous, or she was tortured? Which month she suffered a lot of torture, or she fell on her abdomen, or she had some depression? This because all these things create a lot of impression on the child who is going to born. So this is how we also take a case and treat a person. And we have a theory of vital force. Vital force is the force in the body, which is called QA in the Chinese medicine. And they identify it. Vital force receives the medicine. Vital force reacts to the outer influence. So there is vital force is so intelligent, and homeopathic medicines help our intelligent vital force to be more able to complete the action of healing or to maintain the immunity. This is how vital force is dynamic. So we have to make our medicine to the level of dynamization. So we believe in the doctrine of drug dynamization, where we take the medicines from the different sources and we make into a dynamized medicine through the process of potentization. There are two types of potentization. One is succussion, where we powder it and if we scrape it, then we again powder it, put medicine, sucrose. In sucrose we make it. And other way, we put water and alcohol and we give succussions and we potentize, we charge the water. How it gets charged, you can believe, people used to believe in the older times, don't drink water from a, running river. Keep it overnight, because that water is charged, and whatever it is carrying, it has the charged particles of that. So keep it overnight and then it is, perfect for drinking. So we charge that medicine like we have made some medicine from gold or a metallicum. So we will make it so dynamized that in IIT Bombay, they saw that, our dilution, which carries ions below the level of Avogadro number, where nothing exists. They have been able to see the ions of aurum metallicum there. So that level of medicine also works wonderfully if it is selected perfectly on the basis of similia. If a physician is so much able to hold a good case taking, he can do miracles with that. So all these are the cardinal principles of homeopathy. In health, we live and act and resist without knowing it. In disease, we live but suffer and know ourselves in conscious or unconscious battle. Like if I'm going through some bushes, if I'm sick, I'll get some scratch and it will keep on itching for days, for months. Now I've got sick. I'm not identifying it, but I've got some scratch there. Now something has entered into my body. But somebody who keeps on passing through such irritating bushes and he has not got anything, so he has strength over it. Homeopathy believes that there is an existence of an essential force in every living organism which maintains harmony of the function and also differentiates the living from the dead. the vital force determines the state of health. Vital force determines the state of health in that living organism as mental, physical, and spiritual levels. Susceptibility in organism, mental or physical, is equivalent to state. State involves the attitude of organization to internal causes like stress. I lost somebody, I lost 2 members in the family to COVID, or the external circumstances that I was living in a very unhygienic condition near some sewer gas. I have to inhale that sewer gas all the time because I am working somewhere, or my job is at a place where my seat is under the AC, to the external circumstances. Susceptibility, by susceptibility we mean the general quality or capability of the living organism of receiving impressions, that is, the power to react to stimuli. Upon it depends all functioning, all vital processes, physiological and pathological. It can be linked to certain events such as always getting ill after being exposed to harsh cold wind, or suffering a stomach upset after being embarrassed about something, or it may be the result of our living conditions. Anyone living in a damp house is likely to experience upper respiratory tract symptoms after a while, although for some of us it will be sooner rather than later. Susceptibilities can manifest on any level, mental, emotional, or physical. So a physician has to be very intelligent. He has to inquire everything and know whether the patient is working in a damp condition. So you should always be able to remove the maintaining cause, or else there will be an obstruction in the treatment of the disease. If the physician knows how to modify susceptibility in such a way as to satisfy the requirements of the sick organism and bring about a true cure, then he is a physician indeed. Since cure consists simply in satisfying the morbid susceptibility of organism. Like if somebody is sick, he has some symptoms. Based on that symptom, that totality of symptoms, Ayurvedic people will give some medicine. Homeopathic doctors will give some medicine based on those symptoms, mental and physical. So this is the morbid susceptibility. But when people suppress their symptoms with allopathic medication, with chemotherapy, what happens? These medicines even kill the morbid susceptibility and patient goes incurable. To accomplish this, he must know the susceptibility implies and includes affinity, attraction, desire, hunger, that all exist and express themselves. Like in homeopathic case taking, we ask when we have to assess, we'll ask about the generality. So how's your appetite? How many times you feel like eating? So do you feel full? How many times you pass? What you crave the most? When is the time you get uncomfortable? When does your pain increase? We have remedies according to the time. If somebody feels the pain at 4 a.m. only, we have certain medicine for that. If somebody feels dyspnea 3 a.m. in the night, we have certain medicine for that. So we inquire a lot. Generalities first. We know that our medicine is working. First, we have to see whether the generalities have improved. Plus, if the patient is mentally better, this means the medicine is working fine. He also knows that susceptibility implies existence of the wherewithal to satisfy susceptibility, to supply need, hunger, desire, affinity, attraction, and he knows how and where to find the necessary modifying agents. It is a well-known fact that living organism is much more susceptible to similar stimuli than to heterogeneous or dissimilar stimuli. We believe that if somebody is suffering from some disease, and to cure some particular local symptom, if we are giving like to cure diarrhea, if we are giving some medicine which is able to cause constipation, this means we are adding on with one more disease to the patient, and it is going to make a complex disease with which the patient is going to suffer later on. Another factor that affects our reactions to situation is suppression. Suppression means stopping or limiting an action. Just like we suffer from urticaria, some skin allergies, and what we do, we take antihistamine and immediately that thing stops. So this is suppression. Suppression means stopping or limiting, and then it will come again and it will be more aggressive next time. So frequently we limit the vital energy in our body by the use of conventional cures. Examples of the effects of suppression exist from the development of asthma in children whose eczema has been suppressed. This is the commonest example we know. So if you suppress the eczema with steroid cream, it can develop a lot of cases of asthma as well as breast lumps, which we have commonly seen. A homeopathic definition of health is the freedom to adapt to change. A healthy person is able to adjust free according to changing circumstances. So this is the law of natural cure. We believe in similia similibus curantur. A weaker dynamic action is permanently extinguished in the living organism by a stronger one if the latter is similar to the former in its manifestation. As every disease, not strictly surgical, depends on a peculiar derangement of our vital force in sensation and function. I told you this example about the vaccination. So we don't catch diseases, we create them by breaking down the natural defenses according to the way we eat, drink, think, and live. The body may stimulate the immune system to create a fever. So I will go short for that. Like this is normal health. So if there is a disturbing factor, like some change in the environment or in our mental condition, and there is disruption of the normal function, the reaction will be fever, inflammation. A common thing, if you scold a child and child is not understanding why you have scolded and you beat him up, this child will catch high fever at night and you won't get the reason. Just because he is sad and his, he has felt it, his immunity is broken through that trust which he had in the parent who suddenly, scolded the child felt it was not fair, he will have fever, inflammation. Similarly, whatever disease you will catch, infection will enter, your body will react with fever and inflammation. And what will happen, you will have some discharge, like you can have a loose motion, you will be fine. You are having some nasal discharge or cough or expectoration, you will be fine. So once the discharge is produced and released from the body, you get back to the normal health. But what we do in, conventional medicine, we suppress it over here. What we'll do, fever will happen, you'll suppress it. Suppress it with dolo. Dolo is a famous medicine here in India. And so you will get inflammation in your liver, CRP levels will get higher. And then again, then fever will again come, then you will use some more stronger medicines to suppress it. This will create more inflammation. Inflammation will be suppressed and more CRP levels will be, that level will become higher and higher, and then coagulation of blood leading to D-dimers. This is all because we don't let the fever complete its cycle. We are not patient enough to let fever happen for 3 or 2 days. Because we want to sit in air-conditioned room, we don't want sweat to come out because there are 3 stages of fever. Like somebody starts with chills, heat, and sweat. So this has to be completed. The natural process with which vital force helps our body to get healed has to be supported. There is no shortcut to that. Homeopathy aims to cure by treating the patient's totality of symptoms which are mediated through the patient's vital force. Hering's law of cure is considered the most important to the philosophy of homeopathy and possibly other complementary therapies such as naturopathy and acupuncture. How do we know that our medicine is working good or it is curing the patient? There is a law which has to be followed and we need to see that. So, Dr. C. Herring, the father of American homeopathy, was born on January 1st, 1800 in the town of, Saxony, Germany. He said, we have to follow the direction of healing, that is symptoms from top to downwards, symptoms disappearing in the reverse order of their appearance, symptoms within, outward, symptoms from more important organ to less important organ. If you're treating some skin disease and the symptoms disappear and your patient has got asthma, so you need to check. You're treating it wrong. You're suppressing it. If you are treating arthritis and patient has got a heart attack, sorry, your treatment was wrong. So Herring's law of cure tells you that which direction you are going. So if you were having some psoriasis in the head, you have started treating and it is coming down to the left, direction of cure is fine. But you were treating some skin lesion in the legs and it has now reached the head, wrong. So this law helps us a lot to monitor the way we are treating our patients. So Professor James Ewing, who is a very well-known personality in the cancer care, because he was a very famous pathologist in America of Cornell University Medical College. In a lecture upon immunity in 1909 said that the effort to produce passive immunity against the various infections by means of sera, because that time, the vaccination was getting famous, may fail in spite of the destruction of all the bacteria present in the body by reason of endotoxins thrown out in the process of bacteriolysis resulting from the serum injections. The action of endotoxins of all kinds is similar. There is a reduction of temperature, but an active degeneration of organs, which is called a status infectiosus. Now you can imagine why people who are getting vaccinated, some of them are dying. Thus, sterile death is produced where cultures from the organs and tissues show that bacteria in question have all been destroyed, but the animal dies. This problem of endotoxins is at present a stone wall of serum therapy. Professor Ewing cited the case of a patient who received injections of millions of killed gonococci for gonococci septicemia. The temperature came down to normal, but the patient died. He continues, an animal whose serum is normally bacteriolytic may on immunization lose this power. The bacteria living in the serum but not producing symptoms. Thus, a rabbit serum is normally bacteriolytic to typhoid bacillus, but the rabbit is susceptible to infection. If, however, the rabbit is highly immunized, the serum is no longer bactericidal, the typhoid bacilli living in the serum, but animal not being susceptible of infection, the animal dies. It seems therefore that the effort must be made in the future to enable the tissue and the bacteria to live together in peace rather than to produce a state where the serum is destructive to bacteria. We are getting a lot of patients who are suffering up post-vaccination. So we treat a lot of people. What we simply see is that a lot of people receive BCG vaccination and need to bump on the vaccination site. This means that it should leave a big scar. This means the vaccination has worked. But people who had a poor scar or no scar, this means their immunity is being suppressed and affected by that vaccination. So these are strong and significant words from the highest authority on pathology in America that time. In the cases cited by Professor Ewing, we see the destruction, partial or complete, of susceptibility of the normal power of the organism to react to stimulus of either the sera or bacilli. In the case of total destruction of susceptibility, death follows. The condition of patients in whom destruction was the only partial may be better imagined than described. A rabbit or a man whose fluids and tissues are in such a depraved or vitiated state that typhoid or other virulent organisms live and thrive in them without producing symptoms, and who will no longer react to powerful serum, is not in a state of health, to say the least. People say, oh, we got vaccinated, we did not have any symptoms. They feel that they did not get any problem, but their condition was not, their state was not enough powerful even to produce any symptom. That is also not a very good sign. So homeopathy believes that there is an existence of an essential force in every living organism which maintains harmony of functions and also differentiates the living from dead. So you cannot imagine that we can give you some medicine that you will not react to something. You will obviously react to every stimuli, but it could be a very short for you. Like if you got infected with something, you got to sneeze and cough twice, thrice, and you are fine. And your friend could get a severe fever to get rid of that infection. So this is how it explains the immunity level in different people. And the allopathy, it is just running on the germ theory of disease, which is currently accepted theory. It states that microorganisms known as pathogens or germs can lead to disease. These small organisms, too small to see without magnification, invade humans, other animals, and other living hosts. Whereas homeopathy believes that germs are not the cause of the disease, they are the product of the disease. So if you want, I can stop.
All right. Thank you for that very deep look into the homeopathic way of assessing the whole situation. Could have been a whole pre-talk. Unfortunately, we didn't get you on at that. We could have asked you more. Maybe a post-talk can be arranged at some point. So as a final question to Dr. Shenoy, maybe you can give us the Ayurvedic procedure, how studies are made, how you go about certifying a medicine, how to study it, how to test it, and what the protocol is and that.
Listen, it is really a fantastic question. It is very difficult to answer, but we do have some protocols. The methods are there. So Ayurveda is 5,000 years old, you know that. And many of us asking how they have developed this medicine or how they have developed, designed the treatment protocol and all those things. There are 4 methods are available to them also. For us also, there are 4 methods. For allopathic doctors also, there are only 4 methods. We don't have hundreds of methods. The first method is called observation method. The second method is called experimental method. The third method is called interview method. And 4th method is called questionnaire method. So in Ayurveda also, the rishis, the sages, have adopted the same principle. And we too are adopting the same principle because observation method, whether the medicine is really working or not, we have to be very careful. So whether the medicine is working or not, how we will assess? Just by observing the things. 5,000 years back, they observed because blood is red and the Manjista, the drug Manjista, which is also red. They thought that both are red, and why they thought that it may work in diseases related to blood. So that's why they said, okay, this is related blood can be cured by Manjista because there is a similarity on the grounds of the color of both, even blood and the Manjista. So same like this is called observation. Even when we talk about the observation, we have 3 to 4 things here. The observation, we have to observe the patient. We have to observe the disease condition. We have to observe the medicine available, and we have to see the symptoms, whether these symptoms are reduced from our intervention. So this is called observation methodology. So we too assess our medicine based on the observation methodology. So how we, before doing the observation, there is one more method we have to follow because we have to do the literary review, what our literature says about that disease, what interventions are told about that disease, and we have to validate such things in experimentation. That's the second stage. So observation is the first stage, experimentation is second stage. Why we will experiment? We are not worried about the animal experimentation and all those things. Experimentation based on the validation, to validate the things, because for the research you have to collect the data. There are only 4 methods are there to collect data. That's the same thing. Observation, experimentation, then questionnaire, and then the other one is interview. So in Ayurveda also, the assessment is based on data collection. Data collection is based on these 4 methods, and these 4 methods are to be validated. We have to document it, we have to validate it, and we have to come out with beautiful protocol. These are the things are existing now. So we are following the same thing. Same thing is now also followed in allopathy. There is no difference between Ayurveda, allopathy, Siddha, or homeopathy, because all the assessment is based on only the 4 things. So in Ayurveda also, experimentation was there because they have told hundreds of medicines for a single entity. For a single entity, they have told. How they have got it, it is based on the experimentation. They have experimented, they have collected the data, and the justification they have given. Why? How they have collected. The collection of data, because the whole classical literature is based on an interview between the guru and shishya. Guru means the teacher, shishya means the disciple. So the whole conversation was there in our classical textbook. That means they have collected the data on the basis of questionnaire also. So we too have to collect the data on the basis of questionnaire, and after the questionnaire, we have to validate the questionnaire. That is how the assessment will be done, and research things will be done based on the protocol. The last one is the interview method. Even I will quote one whole chapter. It is called as Siddhisthana. There are only 13 questions asked to the Guru, and the Guru describes the whole methodology in 13 chapters. So this is also one of the important tool available for us to assess the thing. So these four are, there is no difference as far as my opinion is concerned. There is no difference between allopathy, Ayurveda, homeopathy, and Siddha. While we talk about the assessment of the medicine and research updates and protocols, and we don't have our some of our people will say Ayurveda needs to have its own protocol because it has got the philosophical touch. Those philosophical touches cannot be measured because most of the things are qualitative, most of the things are not at all quantitative. So when qualitative things are there, assessment is difficult, and the level of assessment is there in allopathy cannot be perfect, and we cannot directly take, but there is up to now, there is no direct protocol developed based on the Ayurvedic literature. We don't have that, but we are designing it, and our scholars are doing work on that, but still we don't have, but we do have tools to assess. So those things I will talk in within 2 minutes. So we are having pramanas.
Sir, just one thing, your video is off, if it's possible to.
Okay. Sorry.
No problem.
So the tools are available. Tools are available in the classics. The tools says that Pratyaksha, Upamana, then Yukti, and Aptopadesha. Aptopadesha is nothing but the philosophical inputs given from our ancestors. So those are unbiased things, and those are practically viable. So for that, we need only one validation because already it is documented. So that is called this one. Then Yukti, because they have given, because I have told we don't have the medicine which is tailor-made for a disease. So you have to do the permutation and combination of, that's what the Siddha doctor has told. So we have to talk about humors, we have to talk about Prakriti, we have to talk about Bala, we have to talk about Kala, we have to talk about Agni. There are so many methodologies are there because this is not the platform to discuss. That's why I just wanted to give a simple way of understanding the things. So we do have our own protocols, but it is not designed now. This is not scientifically validated. But today also we are taking the help of modern medicine, and we are assessing the research updates, research inputs on the basis of 4 methodologies: observation, experimentation, then interview, and questionnaire method. The 4 methods are there. On that basis only we are assessing the things. Do you want me to talk more about that?
If you have any more to say, I'd be pleased to hear more. Because
I will finish it up because the time is running up. Because you said we have to because there are 2 more things are there. But when I talk about Ayurveda, there are few inputs are available. So I said pramanas are there. Pratyaksha pramana, because we have to see the patient direct. We have to assess the patient direct. We have to give the intervention direct, and whether we have to see whether the symptoms are increasing or symptoms are decreasing, or patient is becoming healthy or not. So based on that, we will assess it, because this is called Pratyaksha. And when I talk about the Pratyaksha, there should be a relationship between doctor and patient. That relationship should be a holistic thing, because we believe in unbiased approach. Suppose if a patient is biased and he says that whatever I give, and he says that no, it is not working, then it will be a problem. So this is called Pratyaksha. Pratyaksha will work only when there is a beautiful relationship between doctor and the patient. So that is the thing, that is called Pratyaksha, and Pratyaksha is assessed based on one observation. The second one is Prashna. Prashna is there. You have to question the patient whether you are all right or not, because some of the things cannot be measured by the sophisticated instrument. Suppose I say the pain, it is not measurable. So pain, it is the thing experienced by the patient. Though even in the scientific world, I cannot measure the pain at all. So whatever he says, I have to believe. So this is called, so we are having the methodologies of assessment. So it is called Prashna. So they have given beautiful, which things should be asked on Prashna? Which things should be asked, assessed by observation? They have clearly given. They said the color can be assessed by observation. The symptoms can be assessed by observation. But the pain cannot be assessed on observation. You have to ask. So all those things, even the sleep, it is cannot be observed. It is asked whether your sleep is good or not, because he has to experience it. Even I can say he has slept for 4 hours or 5 hours. It may not be sufficient for the patient. So we have to be very, very careful, because protocols are well designed in our by our rishis, and that is not at all taken up by our community. And I say even I have not done the work all that, because there is scope for us to work on that. So we have to develop, design our own protocol, but we are not doing it. But we have taken the other thing from allopathy. Even Siddha people, even homeopathy people are assessing the whole thing based on their philosophy that may not work. That's why we are always lagging behind the allopathy, because we don't have our own protocol. So now it is time for us to design our own protocol, assess our own protocol, and show this scientific community that our system is also scientific, our system is also systematic, our system is also validated, and documentation is needed. We don't have a scientific documentation. So now our government of India is thinking of developing our own protocol, our own research designs, because there are more than about 150 designs are there in allied sciences and in scientific community, and much of the designs are not at all accepted in our Ayurveda, because our Ayurveda talks about philosophy. Our Ayurveda talks not only about physical strength, we talk about philosophy, we talk about mental things, we talk about social things, we talk about physical things also. But the allopathic protocol is directed towards the physical and mental things, not philosophical things. That is the limitation of that protocol. We have to develop our own protocol.
But that's good. I just want to add one point, because this is really something that also Vinayak, me, Dr. Mahesh, we were talking about this, that when we get something out of this knowledge festival, out of this working together of everybody, how can we assess and validate it in a way that it is acceptable for governments, for governmental entities, and also in the West, where we can go on an international way. But also when we talked with, for example, Dr. Mukesh, he told me that certain allopathic medicine is causing certain issues with people with certain dosha formations. So, and I was asking him if he believes that maybe the pharmaceutical companies are making their medicines with a certain dosha composition preferred or something. And he said, we don't know that. And so I think maybe it's also important to get this kind of point of view, the Ayurvedic point, at least on the physical level, also into the allopathic studies, because it's, it's not that the modern medicine is just has their laboratories and everything is correct, they are also just testing it on some poor mice or a few people. But in the end, we should find some protocol that is applicable to all of these systems, that there is no barriers, no barriers in understanding, so to say. So that's something, I mean, it would be great to have a working protocol on each system for itself, but then also something that works for everyone and brings us together.
Listen, you are right, because you have pointed out a very beautiful thing. Even the Prime Minister Narendra Modi, he talked about when the COVID situation started, he started one integrated medicine system where anyone can go to the healthcare system, whichever the system they likes, because that's the thing. And we are doing some of the, even from our government Ayurveda research center, we have taken some initiative here, because integrative way of approach we have taken. Even government of Karnataka has taken this approach, because in National Institute of Mental Science, this is called NIMHANS, they have started Ayurvedic clinic there. So integrated approach. Same patient, the allopathic people will give their medicine, Ayurveda people will give their medicine, homeopathy people will give their medicine in an integrated way, so that the benefit is given to the patient. Why? Because our system of medicine has got most of the protocols based on qualitative things. We don't have quantitative analysis at all. But sometimes qualitative analysis will work, because I will give you an example. Because for blood urea, the normal value is less than 20, because the range is very big, 20 to 40. Suppose if the patient is having 40 blood urea, and we are giving the same treatment, if the same patient is having 20 blood urea, we are giving the same treatment, because there is no difference between, because we treat 20 as the same patient and 40 as also same patient, but it will not work. So that's why the qualitative things, because we have to say this is low, this is medium, this is higher. So we need both. Not only the quantitative things, we need qualitative also. When quantitative and qualitative together works, it will be, the benefit is passed on to the patient. So we have to work on that, and we will, I think this knowledge festival has given us more and more inputs, and thank you, Vincent, thank you, Mahesh, and my special thanks to Vinayak Nair, because he has taken that initiative. This initiative should have been taken from the government side, but I really congratulate the whole team, because they have taken the initiation, and I think this is the first time in history, because I repeat it, this is the first time in history, all the system of medicine people are all on one platform, and we are seeing their inputs. That's why it is called as festival. It is festival, real festival.
Thank you. Yes, that's why. So we're coming to a finishing line. I just, we had kind of a study with the SIDA system, but we would like to give Dr. Karen Raima.
She wants to, I think they have to leave, I think.
Oh, she has to leave. So
No, it's okay. I can say.
just a short, because anyway, we are almost out of time. Just a short look into how SIDA goes about saying this medicine is right for this, and how is the study going about?
Okay. So, like I said before, we follow the tri-humor basis, and as the Ayurvedic doctor said before, we have this different practices and different researches going on. So first, before I talk about that, I would like to talk about this, how the research is going on right now, and how the SISA system has developed right now. So now there's this collaborative project between Ministry of Science and Technology, which is known as the Traditional Knowledge Digital Library. I think everyone would know about that right now, because here the Ministry of Health and Family Welfare, the Department of Ayush, and the CSIR and Ministry of Science and Technology, everyone have gathered together and they have started this PKDL. So what would they do here is that it is an effective tool for the protection of the traditional knowledge. So here people they come together, they convert they will translate the languages. Not only if for example Siddha is mostly present in Tamil language, and it has been like that since the olden age. So now we can convert it into different languages. Now they're converting it into 5 international languages such as English, French, German, Spanish, and Japanese, and even more language should come in the future. So this is how they convert it, and that is how they strengthen the international forum, and that is how they converse it, and that is how they take it throughout the world, and that is how we still keep the Siddha system, still keep it going. So about the practice and how it is going on right now, I would like to talk about the good manufacturing practice. So the GMP, like we can talk about it as GMP guidelines, like like how sir has said, Mr. Nasiri sir has said, people don't know about the amount of the manufacture, and they don't know about the level of the amount of drugs which they take or whatever it is, because they are deprived of that knowledge, and that is why we are learning about GMP. GMP is also known as good manufacturing practice, which is followed in Ayurveda, Siddha, and Unani drugs. Here, they have a general requirement. It is so detailed that through which you can know how they follow in a manufacturing practice, how the building, the water system, the disposal of the waste, warehousing area, and each and everything. They talk about each and everything, and especially about how the drugs should be formed and how it should be taken through. So about the drug system, people take it in a we have to take it in a particular manner, and people also should follow that. When we talk about the Siddha medicine, people don't follow it because it takes time to show its work, but it shows a permanent work. For example, how does a fever occur? A fever occur after showing its symptoms of making the body all heat, and we'll get all dizzy, or everyone will have a different types of headache or vomit or whatever it is. But you will know that you will get these symptoms even before a day when you get the fever, when you get the temperature. So like this, and it will take a particular amount of time for the fever to come down. So that is how Siddha system works. When we take a modern medicine, the system it works in a effective manner. It works effectively and it works in a shorter span of time. But it is just a temporary relief. But when we take Siddha system of medicine, we'll diagnose the right aspect. We'll diagnose what it is through our like I said, like the end through our many more aspects of Neelkuri, Nekuri, Manikadai Nool, or there are many systems through which we can find out, and then we can use it to diagnose what is it even in the starting stages. So through that we can find out the reason, and we can kill it by the root cause. That's how we can say it as a saying. So that is how we can work through it. So it might take a longer effect of time. It might take a particular dosage of time, and that is how it acts. So yes, that's about it.
Oh, thank you. That's great. So this way we have all the ingredients for the 3 systems to know how each of them goes about doing this study and research work and assessment. So we will have to find ways. This is a real first step. We're just building up everything so that over time we get to some real points, because right now we're not there yet. So Vinayak, if you want to add something, because we are going to finish this, right?
Absolutely. I just want to thank Dr. Lakshminarayanan, Shenoy sir, Dr. Mehta, and Dr. Karen Ramya for taking their time and being with us. Just for the info, because the pre-video from Dr. Lakshminarayanan sir was actually taken out from YouTube, because there was an argument that what he was saying was not as per WHO protocol, but even though it was a Ayush protocol, so but I think we put some complaint, but I think still didn't work, which is also in a way that we are getting noticed for what we are doing actually. So in some way, so I'm just talking about your talk actually, which you are done as pre-talk. There were some troubles from the YouTube actually, because they said that is not part of WHO protocol, even though what you said was part of the Ayush protocol actually. So that's why we didn't want to focus basically on COVID, because that brings in all the politics and things like that, and really focus on immunity. But even though we are speaking about immunity, we are actually speaking of all other aspects regarding the health, because till this point where we have taken medicine, we were talking about nutrition, we were talking about environment, we were talking about mental health, and all these aspects. I think all the systems, they agree on those fundamental things. The difference lies only when it comes to prescribing medicines actually, and there where the actual how we say fight or trouble that happens actually, who should give what. And that's why I think one question which actually also was important, that because when we say immune booster, now with the COVID, everybody is actually putting that label to anything that they are prescribing, everything is immune booster. I would actually ask you to maybe make it clear that what is the right approach to that actually, because people are not clear about, okay, should I do it, should I take it, how I take it, because a lot of people are taking too many supplements. And sometimes we see in clinic actually, because ashwagandha is good, that is good, selenium is good, zinc is good, vitamin D is good, people are taking like 10 12 supplements together and coming and having other troubles because of that actually. So I think we have to make it clear, what you have to take a professional help when you want to take some kind of things like that. So maybe you can put that point out. I think, what do you think about that? What should people actually, what is the right way to take a supplement or take a medicine? What is the right way actually? Should they just blindly follow what's being prescribed by by the media or by different people, or should they take a professional help for this? Maybe Shenoy sir can maybe just sum it up at the end.
You are right, because even when we are doing the research, because when we talk about these things, because in the last week, because Government of India has promoted I-64 as a curative line of treatment for COVID. Now, 2 days back, it appeared in the Indian Express that I-64 is not at all validated, because they have done the study for 30 patients, and it is not statistically significant. That's why they said the effect of I-64 in COVID patient is a question mark. All these things are happening, Vinayakji, because we are also come across, because as a researcher, I have developed the protocol and I have asked the nodal agencies to give us permission to do it on patients. Now we are awaiting it, because we have not. That's why in my protocol I have said I have designed this protocol based on the literary review on the ancient literature. That's what in the first line only I have put 3 disclaimers, but I have not shown in my presentation. But in my protocol I have put these 3 disclaimers, because we have not validated it. It is only a documentation, and it is based on the expert opinion of the COVID committee members. They have looked into the literature, and the problem why it started that we don't have a direct reference of COVID-19 in our classics. So it is not possible for us to do the research on that, clinical research, because it takes longer time, because we don't have a direct research. In our classic, we don't have a direct thing that this is COVID-19, as Gwara, Atisara or Raja Ishma, we don't have a COVID-19. So now it started from nomenclature of the disease. And when I say the nomenclature of disease, Somebody will say that no, this is not Ajwara, it has to come to Kasa. Somebody will say it has to come to Atisara and all those things. So many loopholes are there, so many lacunas are there. It's very difficult. Still, what you have suggested is really correct, because we have to be documented first. We are doing the documentation because, as you have already said, we have distributed more than about 25 lakhs of Ashwagandha Avaleha, Chavanaprasha, I-64 to the patient, and we have taken the documentation or not. It is not possible to collect all the documentation of 25 lakhs because it needs huge manpower. It is very difficult. But 1% of those patients we have documented it. We are following it after 1 year also, because we have seen, because there are 3 researchers are going on Ashwagandha versus vaccination. Whoever is not taken the vaccination, they have taken Ashwagandha. What is the result? Who have taken vaccination and we have given them Ashwagandha Avaleha, what is the result? Who have taken the vaccination, we have not taken Ashwagandha, what is the result? These things are going on more than, because even ICMR, even along with the CCRS, they are doing it. More than about 10,000 patients they have documented. Whoever is vaccinated, for them we have given Ashwagandha Leha for 3 months, 6 months, and all those things. After that, repeated attacks of COVID has come or not, and we have to statistically, we have to say that statistically and clinically this is valid. It takes time, but we are doing that, because it may take 2 to 3 years, because we have to see the early effect, we have to see mid-term effect, we have to see long-term effect, we have to do the toxicity studies, because I cannot give you guarantee that there will not be any toxicity. So when we wanted to validate it to the scientific world, we have to give all those things, because I have not given the whole thing. That's why many questions appear, because it is not possible for me to give also many of the things, because there is no direct reference for this disease. There is no thing, because we are doing something which is based on our experience. So because the disease is also new, there is no reference, there is no drugs. So we are doing some work. Something is better than nothing. That is what my thing. So we are doing something, but I cannot guarantee you that yeah, it is 100%. That's why in my protocol I have designed 4 types of preventive protocols. You have observed that. So for general public, what is the protocol? And somebody asked me, sir, which type of yoga? Do you have a scientific validation for that? I don't have, because it takes time. If you ask me after 2 or 3 years, definitely I will give that this is the study we have done for, because it is the population is large. So I cannot give you a data of 30 patients or 40 patients or 50 patients. It needs at least 1 lakh or 1.5 lakhs data, because the population is large. I cannot take a small sample and say that this is valid. So that is the problem we are facing. It because it needs time, it needs manpower, it needs an infrastructure, it needs funds too. Yeah, all those things we are having crunches. We are having crunch on manpower, we are having crunch on infrastructure. So these things are there. And scientific, the more thing is that scientific fraternity is not believing in Ayurveda. That is the Ayurveda or Homeopathy or Siddha. I am not talking about that. So this is the thing. But we are doing, we have not lost hope on this. Definitely we will do one or the other day on this platform only. I will come with great data.
Yes. No, we will get step by step done. But right now, I think also this video was flagged on Facebook.
Yeah, correct. No problem.
We have a few of them flagged by several TV stations for some reason. I don't know why, but it's just the way it is. When you go in a different direction for some reason, people will not always like it. So we will live with that, and we will try to make clear that we are not in it for war. We are in it for coming together and finding real solutions, because some things are not working. This is just all that matters in the end. And hopefully sooner than later.
For me, if the criticism comes, it is welcome. If they
Yeah.
say you are doing some good work, it is also welcome. So we don't, we
No,
are
I
not
mean-
worried about.
I mean your pre-talk video also, there was nothing really
Correct.
outrageous or bad in it, or saying
Correct,
anything non-scientific. So it's just really a political issue, and
Correct. You are right. You are right. We
you
don't
know,
have any problem.
so
Whatever we have done, we have presented it. But
yes,
I will not give guarantee that can you give me a scientific validation, because time, I need time for that.
right,
Definitely, we will definitely give you a scientific validation in future, definitely.
right.
And I can come on this platform only and say that whatever I have said is right, or whatever I have said is wrong also, I am open on that.
Very
No
good.
problem.
We're looking forward to that. So thank you everybody
Dr. Mahesh
for.
would like to add something, he said.
Oh, all right. Sorry. Go ahead.
Mahesh, so please go
Okay.
ahead.
Yeah. Actually, with respect to the all people in the in the room, what I'd like to add up here is as I experience people with respect to designing a protocol. We take the modern protocol as such only to facilitate easy validation. And what we have already seen also, as Dr. Shenoy had already pointed out, that a protocol cannot be designed overnight, whether it is for modern science or more for an Ayurveda and anything. It has its own process to be filled up, like the guidelines what we have. Now, when we design the protocol and ask for a scientific validation, so there is actually no scientific validation even for COVID at present for any medicine, including the modern system. But it's an assumed protocol that we are all bound to. Just like how the turning down of iOS 64 has done. Same way, there are many things that have been turned out. Actually, today I just read a news that the Pfizer's COVID-19 vaccine created a heart attack in one 16-year-old kid in Singapore, and the person was given 1.2 around 150 Singapore dollars, 1,000 Singapore dollars as compensation. So that is what no one knows what is it. And first thing, second thing is, if I speak to validate Ayurveda as scientific, the first thing is, what way should I express it to be a scientific thing? To express it as a scientific, it is because every science, including modern and Ayurveda or any other science, I should believe that they have some basic principles, and the person who wants to hear about this or any science should understand the basic principles. If they are unable to understand, then there is a problem to understand the science itself, because the basic is, if you cannot understand the basic of every science, how will you understand the complete structure of that science? So that is how usually we are pointed, or any of us are pointed as the irrelevant or unscientific, because they are not able to understand what the science, on what basis this particular thing is standing on. Today, I think I can also refer to an article that they have developed a metal from water in Europe. That was an article, which is an alchemic procedure. Now, earlier the same system was telling that alchemy is a false. Today, they have developed it, and now they have started believing it to be something that is happening. So this is how I think the modern science has to evolve still more to understand what Ayurveda is. I think so. That is why it may take some time, but when they evolve, they will understand what this science is really, and then only they can really appreciate what we had been telling all these years. I think with that, I will hand over to you. Thank you.
Thank you. Step by step, I think just this would be a first step. Yes.
Mahesh, it is really wonderful. Thank you for beautiful inputs.
So, well,
Welcome.
So with that, I would just say thank you to everybody participating and viewing this. And if you've been on Facebook, you got the link to jump over to YouTube because it got blurry. The video got got blurry on Facebook. So okay, and this was the 5th day. A great one, full of beautiful papers and great discussions. And come back tomorrow. We have a final weekend of knowledge. Let's do some beautiful stuff tomorrow, same time. And for today, have a beautiful one. Goodbye.
Thank you. Thank you.